Hello, everybody. Welcome to Physio TV. So, today we have with us our esteemed speaker for the day, Mr. Shashwat Verma. So, speaking about Sir, he's an assistant professor at Ramya College of Physiotherapy with over 15 years of experience in academics and clinical practice. Sir holds a master's degree in cardiovascular and pulmonary sciences and a postgraduate diploma in yoga, along with a fellowship in radiology for physiotherapists. His expertise includes intensive care and pulmonary rehabilitation, and he's currently pursuing his PhD in pulmonary rehabilitation. Sir has authored 15 plus publications and holds 3 patents. He's involved in the ATS MECCA project and a seed grant study. At the university, Sir contributes to curriculum design and serves on various committees. In 2023, he has received the Annual Exemplary Teachers Award. We welcome you, Sir, handing it over to you for the further session.
Uh, Thank you for that brief introduction of mine. And I'll be starting with the session. So we chose a topic which is very crucial for all of us, especially when we work in ICUs and treating patients with respiratory disorders. So we all know how to look at the ABG values. We know how to read the ABG values, but then we do not as such work on how exactly the breathing exercises needs to be chosen in right manner, which aids in helping the patients with any kind of ABG disorders, whether it is metabolic or whether it is respiratory system. So I am trying to uh, give a small but crisp thing about breathing exercises which tailors to our ABG values. So let's begin with it, giving a small uh, brief thing about what is ABG and how does these things works. So ABG is an essential part of diagnosing. ABG is also called as arterial blood gas. So it's an analysis done, which is an essential part of diagnosing and managing the patient's oxygenation status, ventilation failure, and acid-base balance. It refers to physiological mechanisms that keep the hydrogen concentration of body fluids in a range which is compatible to life. Normally, the pH of the fluid is 7.35 to 7.45. It ranges in between that value. But when we talk about pH, what does it mean? When we talk about pH of fluid, which fluid are we looking at? So we are looking at the fluid which is blood, which is in abundance in our body, and pH is the concentration of hydrogen ions in the body. That means how the hydrogen ion is going up or down in the blood determines whether the person is having respiratory or metabolic acidosis or alkalosis. So where does these ions come from? They are basically comes from volatile acids, which is your H2CO3, which is easily dissociable, and there will be a free radical of H plus ions, which can be seen. So we all know this equation very clearly, H2CO3, which can get dissociated into CO2 and H2O, which again get dissociated into HCO3 minus and H plus ions. So from here, we get this H plus ions. If this H plus ions does not get buffered by anything, then it stays as a free radical, and this free radical causes acidosis or alkalosis or moves the pH of the blood higher or lower. How does this uh, H plus ions gets buffered? So these gets buffered with the help of something called as base. So we have acid, which is in the form of H plus ions, and we have base, which is in the form of HCO3. So this has to get attached with the base to counter the abundance of H plus ions, maintaining the pH of the blood to the normative level. It should not increase, it should not go less. The entire buffer system is divided into two systems, open and the closed system, where it's also called as bicarbonate or non-bicarbonate buffer system. Where do we find all these things? So plasma and erythrocytes have a lot of bicarbonate buffer systems, whereas non-bicarbonate will be having mainly the phosphates, mainly the proteins, and the simplest one which is there in the body, hemoglobin. So all these things are work as a non-bicarbonate buffers. What is non-bicarbonate? The word says bicarbonate. This should not be there in this, like sodium bicarbonate. If sodium bicarbonate, it becomes buffer system. So sodium moves out, H plus gets attached, so it becomes bicarbonate buffer. But hemoglobin does not have a bicarbonate attached to it. It's just a hemoglobin. So it becomes hydrogen hemoglobin or heme hemoglobin. The buffer system do not work in isolation. Both the buffer system works together, whether it is an open buffer system or the closed buffer system. Both has to work together to bring the pH of the blood into normative levels. They cannot work in isolation. Now, when we talk about the open buffer system, it is mainly we talk about the respiratory system because ventilation or the respiration is something which acts. When we talk about the closed buffer system, we mainly talk about buffering it with the help of renal system. Where does this acid get excreted in the body? So we have the lungs, we have the kidneys where the acid gets excreted. So acid in the blood is mainly, or the lungs is mainly the CO2, which is causing the acidity in the blood, or acidity increase in the CO2 levels causes the acidosis in the blood, where the pH starts moving down. The less number will be there. The more number will be there. Whereas Whereas the kidney, excessive secretion which happens, that eliminates the substances from the body in urine. So that leads to acidosis in the system. So there will be renal system which will be acting, and there will be respiratory system which be acting. Now, what we need to understand is carbon dioxide, that is the respiratory system, fixes the entire thing within few minutes, seconds to minutes, whereas the renal system takes longer time. It requires hours to days to fix it because renal system acts very slowly, but in it acts in a proper manner. So this is HCO3 minus in blood, which passes through the glomerular membrane to become part of the tubular filtrate, whereas the tubular epithelium secretes hydrogen ions into tubular lumen to join the filtrate. The process removes the base from the blood. That is what is more important. So the entire thing removes the base from the blood. So if the base is removed from the blood, that means it again led to acidosis in the body. So we need to understand that kidney needs to reabsorb or excrete the base to maintain the pH. What are the different types of acid-base disturbances what we are going to see here? So we are going to see alkalemia, acidemia, whether there will be a hyperventilation or hypoventilation, or there will be hypoxemia. They are called as respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. How are we going to read the ABG? So there are many part of the ABGs which are supposed to be read. For example, you have pH, which is basically the hydrogen ions. PCO2 is called as partial pressure of carbon dioxide. PO2 is called as partial pressure of oxygen. HCO3 minus is the bicarbonate. Be is the base excess. SaO2 is the saturation of oxygen in arterial blood. So SaO2, SpO2 are the two things which is there. SaO2 is more accurate as it is invasive in nature. What are the normative values of these? So pH 7.35 to 7.45 is the range. You remove 7 point from both the sides, you will get the value of PCO2, that is 35 to 45 millimeter of mercury. PO2 depends upon which kind of machine you are using. It shows more than 100, it shows less than 100. 83 to 100 is the normal values. Bicarbonate is 22 to 26. Base excess is -2 to +2. What does it say? It says minus means it's the base is less in the body, plus is base is more in the body. And SaO2, anything beyond 95% is considered normal. But nowadays we say anything above 85% also is considered good enough. So what are the different steps to interpret the ABG? So the first step is assess the pH. So what happens is we usually start doing an ABG interpretation from right hand side to the left hand side. We do not do it from the left to right. The second one is talk about whether it is a respiratory system or it is a metabolic system. What is causing the pH to go disturbed? Whether it is the respiratory system which is causing the disturbed pH, whether it is metabolic system which is causing the disturbed pH. If we find this, then the third option is what is compensating this. So whether it is being compensated by the, that means the primary is the respiratory system or primary is the metabolic system. So we need to know which is the primary uh, system which is causing and which system is trying to compensate. Based upon that, your treatment will take care of. For example, if there is a respiratory system which is the primary cause of causing disturbance in the pH, then you can work with the breathing exercise. But if the metabolic system, that is the renal system, is the primary cause of disturbance, then doing any kind of breathing exercise will cause difficulty or will hinder the performance of the entire body. So we do not do much when it is metabolic system. So to know what system is primarily involved, we need to know the steps and we need to know the uh, way to do it. So I am just trying to see if I can use the what is called as black whiteboard into this. The pH is always read in this direction. This is the first step, this is the second step, and this is the third step. That means the first step is about pH, whether it is gone into alkalosis or acidosis. The second step is what is causing this disturbance in the pH. Is it the metabolic system or the respiratory system? So if it is metabolic system, that means HCO3 is disturbed. If it is respiratory system, that means CO2 is disturbed. And the third aspect is if whatever is the primary cause here in the step 2, the secondary, that means if it is metabolic, whether respiratory system is trying to compensate the disturbance or not. So what I mean to say here is never read the ABG from this direction. This is wrong method of reading it. Always read the ABG from right to left. So start reading from the right hand side. It will be very easy for you to understand. I'll repeat it once more. First step to read the abnormality in the pH. The second step, what is causing the abnormality in that pH, whether it was a metabolic system or the respiratory system. And the third step, whether the other system which is not primary is trying to compensate or not compensating. So this is the three steps in reading the ABG, what we need to understand it. Every disorder, whether it is a respiratory acidosis, respiratory alkalosis, metabolic acidosis or metabolic alkalosis, have the symptoms. The symptoms are very simple. This is respiratory disorder, acidosis, where there will be dyspnea, there will be respiratory distress, there will be shallow respiration, In nervous system, it will lead to headache, restlessness, and confusion. If the CO2 levels are too high, then it will cause unresponsiveness or drowsiness. The CVS shows tachycardia or dysrhythmia. When we talk about this respiratory acidosis, what am I looking at? I am looking at pH is on the lower side. That is, it is less than 7.35. CO2 is on the higher side. That means it is more than 45 to 50 or more than 45 to 50. It could be beyond 50 also. So it can be anything which is more than this level. This is respiratory acidosis. So it's very simple. Respiratory acidosis means CO2 is on the higher side. How are we going to manage it? You increase the ventilation. If it is not happening, then force the CO2 out from the body. How are you going to force the CO2 out from the body? Use mechanical ventilation. But as a physiotherapist, what are you going to do? So as a physiotherapist, I need to start doing the breathing exercise. So what kind of breathing exercise will help in uh, removing the CO2 from the body is the expiratory exercises, which is going to help removing the CO2. So always remember, I'll repeat it. Whenever there is a respiratory acidosis, that means the pH is reduced, but the CO2 is on the higher side. So your management breathing exercise, what I am here to tell you today. So its breathing exercise is all going to be reducing the CO2 level from the body. And the only way to reduce CO2 in the body from the body is expiratory exercises. So you can choose pursed lip breathing, pursed lip breathing. You can choose giving exercise like balloon blowing, paper blowing, candle blowing, expiratory spirometers. So all those exercises where the CO2 levels are going to remove from the body is what you have to choose. So as a physiotherapist, we need to choose breathing exercise, expiratory exercises. But what happens when it is a respiratory alkalosis? So in respiratory alkalosis, basically CNS goes lightheaded. There will be numbness, stinging sensation. There will be confusion. Concentration will not be there. There will be blurring of the vision will be there. There will be dry mouth, spasms will be there, palpitations will be there, dyspnea will be there. These are the major common symptoms of respiratory alkalosis. What happens in respiratory alkalosis? Now you see what happens in respiratory alkalosis. In respiratory alkalosis, pH is going to be more than 7.45. It will be more than 7.45. In PCO2, it will be reduced. That means it will be less than 35. Remember, the CO2 values are 35 to 45. Anything less or anything more causes issues in the body, especially with CO2. So here the body says that CO2 is less in the blood. So what are we supposed to do? We have to choose the exercise which increases CO2 level in the body. When I ask anybody, tell me any exercise which increases CO2 level in the body, everybody says, yes, we have to increase. Let's start with inspiratory exercise. Very good. That's exactly we need to choose inspiratory exercises. But what kind of inspiratory exercise will you choose? You choose diaphragmatic exercise, you choose segmental breathing exercise, you choose thoracic expansion exercises, inspiratory spirometer. There are lots, but are these thoracic expansion, diaphragmatic, stagnant inspiration, or segmental breathing exercises or spirometers, are they going to improve the CO2 level? The answer is no, because CO2 is present very, very less in the atmospheric air. So you need to increase the CO2 by inhaling CO2. How do you inhale CO2? So whatever CO2 you exhale, you have to inhale. So use respiratory rebreather masks. You use poly bags. You use envelopes. You exhale in that and you inhale from that. That is going to increase the CO2 level in the body, not your diaphragmatic, thoracic expansion, segmental, or your spirometer. These are not going to increase the CO2 level. The only way the CO2 level is going to increase in the body is by inhaling the CO2 what you exhale. So using polybags, using envelopes, using rebreather masks are the best option to do that. The next one is the metabolic acidosis. Now, what is metabolic acidosis? Now, here pH is less than 7.35, but here bicarbonate is less than 22. We are talking about this. Bicarbonate is a base. So if base reduces, it causes acidosis. So here I am looking at base reduction. How do you compensate the base reduction? If I somebody says compensate the base reduction by respiratory system, so it is going into acidosis. To cause alkalosis, I need to give breathing exercise which removes CO2 from the body. Is it good to remove CO2 from the body? We just now know that if CO2 is less in the body, what are the different clinical features we will get through? So no, reduction of CO2 should not be done by the therapist. You should not cause exercise or give exercises which causes reduction in CO2 because you wanted to match the pH or compensate the pH which is caused by the metabolic disorders. So in metabolic acidosis, do not touch the respiratory system. Let the infusions help gaining the bicarbonate. So here what you do is you let the medical people do the work and infuse, give lot of sodium bicarbonate so that it improves the bicarbonate level in the body. Do not play much with the respiratory system. What do you get? You get CNS, headache, confusion, restlessness, progressive to lethargy, it will cause. In most of the cases, what you get is something called as Kusumal's respiration. So I hope you all know about what is Kusumal respiration. And you feel like nauseating, you feel like vomiting. That is what happens in this. Next one is as I said, what is the management? Management is treat the cause, do not redo the respiratory system into it. So use bicarbonate, use the bicarbonate infusion to push it inside. The next one is metabolic alkalosis. Now, what is metabolic alkalosis? Metabolic alkalosis is where pH is more than 7.45, whereas bicarbonate level is more than 26. This is metabolic alkalosis. How do I compensate metabolic alkalosis with respiratory system? So that means I need to cause acidosis. To cause acidosis, I need to increase the CO2 level in the body. Again, increase in the CO2 level in the body is not a good thing. We saw what happens if there is a respiratory acidosis which happens. So usually we do not try to compensate. As a physio, we do not give exercises which increases the CO2 level in the body. Whatever body does by itself is completely different than what you passively do towards to the body. So what is the base here? That metabolic acidosis, metabolic alkalosis do not do anything. Respiratory acidosis, give expiratory exercises. Respiratory alkalosis, give inspiratory exercises in terms of using the polybags, using rebreather masks, using envelopes to increase the CO2 levels in the body. Now, this is a simple compensation which I have taken it from the book called as Eagles. So it shows what happens if there is a respiratory acidosis and how the compensatory response takes place. So I have made a small chart with this. So if you look at respiratory acidosis, what happens is pH is reduced, PaCO2 is increased, HCO3 is most of the time normal. In metabolic acidosis, pH is reduced. Here it is metabolic, that is the respiratory renal system. So HCO3 goes down. Respiratory alkalosis, pH is more, PaCO2 is not reduced, and HCO3 is normal. Whereas in metabolic alkalosis, pH is more, PaCO2 is normal, and HCO3 is increased because again, metabolic here means bicarbonate system. So this is how it works. What happens with compensation now? So to have a compensation, if pH is down, PaCO2 is up, HCO3 has to go up because HCO3 is a base. To compensate this acid, the base has to increase. Metabolic acidosis, it's the same thing. Both are going in that same direction. Always remember, for any kind of compensation, if you see, I have put 4 compensation. In all the 4 compensation, if you see, whichever direction the primary cause is going, the secondary thing compensates in the same direction. If it is going up, it is going up. If it is going down, it is going down. That is how the compensation happens. But if there is no compensation happening, look what happens to the picture next. It is an acidosis. PaCO2 is causing acidosis. Bicarbonate is also causing acidosis. So can you see there is no compensation happening here? Both of them are going into the same direction of acidosis. This is also acidosis. This is also acidosis. So this is a mixed picture. What is happening? Both the systems are not working together. They both are working independently. They are not working together. They are working in isolation. If this system happens, that means it is not good for the body. Same thing happens in alkalosis. Again, if you see, the respiratory system as well as the bicarbonate system are both moving in 2 different directions. It is not moving in the same direction. So for compensation to happen, both should move in the same direction. But if it is not moving in the same direction, that means it is not good for the body, and both systems are working independently. When, as I said before, the system should work together to cause buffering. If both are not working together, the buffering will never happen. I hope this is it. So it's not magic understanding ABG. You just need to do little practice. Thank you, guys.
That was a wonderful session, sir. Thank you so much. I would like to ask a few doubts, queries. So, when it comes to cases of mixed acid and base imbalances, like we often observe in diabetic ketoacidosis, where the patient it might eventually develop respiratory alkalosis due to their breathing pattern. So, do we have a specific approach to determine which is the primary cause and which is the secondary cause for the same?
Yes, so that is the time when we look at the other parts of the ABG, as I said initially. So there is something called as base excess, which is there. Now that base excess is going to determine which is the primary cause of your issue of the damage or of the disturbance in the pH. If base excess is more than +2, then it is the metabolic system which is causing the issue. If it is metabolic acidosis, so if you are looking at mixed acidosis picture and you are looking at base excess of more, then it is, if it is acidosis and base excess is more, respiratory system becomes the culprit. Base excess means what? Bicarbonate is more in the body. Bicarbonate is a base in nature, it's not an acid. So if it is acidosis and bicarbonate is base excess is more, the primary causes respiratory system. If it is acidosis but bicarbonate is in minus, then the main causes metabolic system. So base excess becomes or plays an important role in identifying in mixed picture which is the primary cause and which is the secondary cause. And then you choose your breathing exercises or you choose the management accordingly.
Thank you so much, sir. That was a very wonderful explanation. I would like to conclude by thanking you for your valuable time and for providing us with such an insightful session regarding ABG analysis and how we can add on our respiratory exercises to in the treatment goal and the management purpose. So thank you so much once again. I would also like to thank our chairperson, Ms. Manisha ma'am, our principal, Dr. Purva Shimpi sir, and all our other Physio TV viewers for taking out the time and viewing our session. Thank you so much, sir.
Thank you. Thank you.